Good evening, everyone. Myself, ARSHDEEP SINGH, Assistant Professor, Mira Medical Institute of Nursing and Hospital, Abuja. So today I am going to explain you about the topic that is patient classification system. Okay, so let's start with the topic. तो स्टार्ट करने से पहले अगर आपको आवाज मेरी ठीक आ रही है, आप एक बार मैसेज कर दीजिए। अगर आवाज ठीक है तो मैसेज थोड़ा सा आप कर दीजिए नीचे ताकि मैं कंटिन्यू कर सकूं। Okay, so let's start with the topic that is patient classification system. So first of all, a brief introduction about this topic is what is patient classification system. When we are working as a nurse in different hospitals, so there are a number of patients, and based on their uh, condition, so we have to arrange the staff for the patients. Like some patients may be of the severe condition, some may be of the mild condition, and some may be suffering from minor ailments or any other type of. We can say that the conditions which can be controlled in an easy manner. Okay, so we have to think, or we have to arrange the staff according to the need of the patients. That uh, we have to arrange a team for a patient who is in serious condition, who is in the mild condition, okay, mild or moderate condition. So depending on the need or the situation, we have to arrange a staff. So that is the patient classification system. That means we classify the patients according to their needs, and we arrange the staff according to their needs so that we can provide care in a very effective manner. Okay. So next, first of all, is the definition of patient care. What is patient care? It is the services rendered by the members of the health professionals and non-professional under their supervision for the benefit of the patient. Okay, so what is this? Is the services? These are the services that are rendered by the members of the health profession, like the nurses and the other type of persons under their supervision for the benefit of the patient. Means say that depending upon the need, there is the providers of care by different categories of the health professionals. Second one is the preventive treatment and management of the illness and the preservation of the mental and physical well-being through the services offered by the medical and allied health professionals. Okay, this is the same thing as compared to the first definition. Just the lines are the different, sentences are the different. So it says that the patient health care or patient care is the services, different types of services that include the preventive treatment and management services that are provided to the patient so as to lift up their health status in a positive. Okay, so in this, we also provide the mental, physical well-being services that relates with the physical and the mental dimension of the patient. Okay, so that is about the definition of patient care. Next is the main topic of today's lecture, that is patient classification system. So that is PCS, which quantifies the quality of the nursing care, is essential to staffing nursing units of hospitals and nursing homes. Okay, so what is patient classification system is the system that quantifies the staff and it categorizes the patient according to their needs so that we can arrange and organize the staff that what type of staff is required for the providers of care to the specific persons or the patients. Okay, and selecting or implementing a PCS, a representative committee of nurse manager can include a representative of hospital administration. Okay, so if we are implementing the PCS in an hospital and or in an organization, there is the need of the representative committee that will supervise the PCS. And the primary aim of PCS is to be able to respond to the constant variation in care and the care needs of the patient. So, if, for example, if an organization is running a hospital and there is a staff and the different types of patients, they come and go. So, it is the organization or the management or the supervisors of the health hospital that will make a committee and that will supervise the PCS system. That means to which patient we have to assign which type of staff and they how they will be able to provide the effective services in that situation. Okay, so that is patient classification system. So next is about the characteristics of the PCS. So there are different characteristics in this. Firstly is the differentiate intensity of the care among definite classes. Okay, so what type of care is needed in different type of categories of the patient? This is the first category, first characteristics that to know about the level of the care that is to be provided to the patients. Okay. Next, second is measure and quantify care. Develop a management engineering standard. Okay. So second characteristic is that uh, we have to measure. So and also quantify uh, a system of an engineered system of the different standard that like this or like in this manner we will be able to provide the care to the patients. Third is the matching nursing resources to patient care requirement. So we are arranging the stuff according to the needs. That is the basic characteristic of this PCS. Uh, so matching nursing resources, what type of nursing resources we are having, and what is the patient requirement, patient's requirement according to that stuff. Okay. Next is related to time and effort spent on the associated activity. We have to save the time. We are under the PCS. We implement a different type of care systems. Okay, like the team nursing or the other type of we can say that the systems. So we are saving the time and effort, but we are providing the effective services or the results. Next, be mutually exclusive, containing new item under more than one unit. Be open to audit. Be understood by those who plan, schedule, and control the work. So these are the different characteristics that we have to audit the work done under the PCS. It should be auditable. Okay, we can evaluate the specific characteristics of that system and be individually standardized as to the procedure needed for the accomplishment. Okay, so we should be having the PCS includes a certain specified standardized criteria which have to be followed so that as to provide the care to the patients. Last one is the separate requirement for registered nurse from those of the other staff. Or it is about the organization of the staff in an organization. Okay, so separate requirement for the registered nurse from those of the other staff is required. Okay. Next is the about the purposes. The system will establish a unit of measures for nursing, that is time, which will be used to determine number and kind of staff needed. So PCS is under the umbrella term of the organization that is covered under the organization. So in this, we are organizing the staff according to the need of the patient. Okay. So first purpose is that is relating with this sentences that this system will establish a measure for nursing, that what type of staff or in what quantity we there is the requirement of staff in a hospital according to the different types of patients. Okay. Second, program costing and formulating of the nursing budget. It is obvious that when we are recruiting for example, the nurses in the hospital, so we are clear about the budget that this is the number of the nurses that is required by our hospital, and this is the amount of the salary that has to be paid to those nurses. Okay, so that includes the program costing and formulation because this PCS will include a major budget that have to be that the organization had to pay up to the nurses, those who will provide the services under this system. Third is the tracking changes in patient care needs. It helps the nurse managers the ability to monitor and control delivery of nursing service. So it is a very good system, and its purpose is to save the time and effort and to provide effective services. Because if we are assigning a specific person, specific professional or the worker or a nurse for a specific patient, to manage the things in an effective way, So we will be able to provide the nursing services in an effective manner. Okay. Next, determining the value of the productivity equations. So what we are getting and what we will get, we can measure from this system. And next is determining the quality. What type of the quality we are going to provide, what we are actually providing. So we can evaluate from this system. For example, once the standard time element has been established, staffing is adjusted to meet the aggregate times. So under the PCS, if we are implementing the PCS, so there is a certain specified of the set criteria that this is the amount of the staff required in the hospital, and these are the type of patients that regularly comes to the hospital, and we have to provide the services to these patients, these categories of the patients. Okay, and nurse manager can elect to staff below the standard time to reduce the cost. Okay, so it is a very useful method. We can say that the system that can help to save the time and effort and to provide the good services. Okay. Next are the components. There are different components of the PCS. That includes that the first component of PCS is a method for grouping patients categories. So that is the very important and the basic. We can say that the component. Firstly, we will categorize the patient according to their needs. So there is a table. I will explain it in the next slide. How we can categorize the patient under the PCS. So Johnson indicates two methods of categorizing patients. Using categorizing method, each patient is rated on independent elements of care. Each element is scored, scores are summarized, and the patient is placed in the category based on the total numerical values obtained. Okay, so Johnson uh, is the name of the person or the author who researched on this system, that is PCS, and gave us the method that how can we categorize the patients on the basis of their needs. Okay, for example, the elements of care. What type of care is required by a specific patient? Is he or she is able to do the activities of the daily living? Uh, can he or she take the bath? Can he or she eat the food himself or by herself? Okay, so these are the examples by which we can score a patient according to the needs of the need of the care by the patient. Okay, so that is the method of categorizing the patient. Second one, Johnson describes prototype evaluation with four basic categories for a typical patient requiring one care. Each category addresses activities of daily living, general health, teaching, and emotional support. So these are the 4 points that I was talking about. That's the daily living, general health, teaching, and emotional support. On the basis of these 4 points, we categorize the patient. Okay. And next, some two more points are there: treatment and medication. What type of treatment and medications are required? These are also the 2 points. Data are collected on average time spent on direct and indirect care. So this is how this is the first component, and by the help of this component, we can categorize the patients. Next, the second component of PCS is a set of guidelines describing the way in which patient will be classified, the frequency of the classification, and the method of reporting data. Okay, there are the different type of guidelines. Okay, that is second component is a set of guidelines describing the way in which the patients will be classified. Third, the component of PCS is the average amount of time required for care patient in each category. So firstly, we are classifying the patient, and then we are assessing the time that is actually required by the specific patient according to their category. Okay, a method for calculating required nursing care is the fourth and the final component of PCS. So, what is the time in hours are required by a specific patient for the care, effective care? So, that is the fourth. Okay, so let me show you the chart. So, it includes that is the patient classification system, as you can see on this table. First of all, is the area of care. That includes the different areas by which we are classifying the patients. The first it includes eating. Second thing is the grooming related to the hairs. Third is excretion of the waste. Next is the comfort, level of comfort. And then is general health, then is treatment, and then is health education and teaching. For example, we are having the four categories of the patient in eating. Which type of patient will be in the category 1, 2, 3, or 4? For example, the person or the patient who will feed himself or herself will be in the category first. Second category needs some help in preparing. Third, cannot feed self but is able to chew and swallow. So that is the, we can say that from category 1 to category 4, the condition is worsening. Okay, the persons who are having patients who are in good condition, but they are having some problems of the diseases, but are able to do some of the things in their own manner. So they are placed in the category 1, and rest of the categories, like the second, third, or fourth, are having the patient with the worsening conditions. Okay, so as you can see that in the category 4, cannot feed self may have difficulty in swallowing. Okay, so the patient, the person in the category 4 cannot chew or cannot swallow himself, or is he or she is having a difficulty. Next is the grooming. In the category 1, for example, almost entirely self-sufficient, as I have already explained. Second, needs some help in bathing, oral hygiene, and third, unable to do much for self, and last one is the completely dependent. As you can see, the category 4 is the of those patients, the person who are completely dependent on the nurse or the next person, the health professional, okay, for the care. Third is the excretion up and down, up and to bathroom alone. And second category patient includes needs some help in getting up to the bathroom or urinal. And next is in bed, needs bedpan placed. And last one is completely dependent, and we have to categorize that type of patient, the category 4. Okay, so you can see that we are categorizing the patient, and this is actually what we do in hospital. So that is an example of patient classification system. Fourth is area of care, that is comfort, self-sufficient. Second category includes needs some help with adjusting positions of the bed. Third includes a cannot turn without help, get string adjust position of the extremities, and last one is the completely dependent. Next is the general health. It is obvious the category 1 persons would be having a good health status, category 2 with the mild symptoms, category 3 with the acute symptoms, and last one will be the critically ill, as you can see from the activities that they are performing. Okay. Next one is the treatment. So in the category 1, obviously simple supervised simple dressing, and in category 2, any treatment more than one per shift, polish catheter, intake and out. Okay. Next, any treatment more than twice shift. And last one is any elaborate, delicate procedure requiring two nurses were done more than often than 2 hours. So uh, these are the treatments that are to be provided to different categories of the patient based on their condition. Last is health education and teaching. Routine follow-up of the teaching, because the patient is having good health status but is suffering from some problems. Second is the initial teaching of the care of the ostomies, new diabetic patients with mild adverse reactions to their illness. Third one include more intensive items, teaching of the apprehensive, mildly resistant patients, and last teaching of the resistant patient. The patient will not respond to any type of health education because that type of person in the category 4 is completely uh, in the severe condition. Okay, so that was about the patient classification system. So in next one is the modes of organizing patient care, methods of the patient assignment. So how will we arrange staff? Now we have categorized the patient according to their condition, but how we will select or a staff will work in the providers of the care to these categories of the patient, these 4 categories of the patient. So there are different methods. Total 7 methods are there. First include the case method of the total patient care. Second is the functional nursing. Third one is the team nursing. Fourth one is the modular or district nursing. Next is the progressive patient care. Next is the primary nursing, and last one is the case management. So these are the 7 methods or the modes of organizing patient care. Depending on the category, we are choosing one of the methods from these 7, depending on the category of the patient, so as to provide the effective care. In today's lecture, I will explain firstly, I will explain about the first 2 methods, that is case method, and second one is the function nursing. Okay. So first one is the case method, as it is clear from the name, a single case. So what are the features of this method or mode? It was the first type of nursing care delivery system. In this method, nurses assume total responsibility for meeting all the needs of the assigned patients. during their time on duty. So it is clear from the name case method. That means the total number of the nurses or the single or two or three. It might be in either of any number. So the total nurses will be responsible for a single person or the patient, and for the each and every care that is to be provided to that specific patient. So those health professionals will be responsible, the nurses. Okay. It involves assignment of one or more clients to a nurse for a specific period of time, such as shift. Okay, in a shift, one or two or more than two, we can say that the patient will be assigned to the nurse, and that nurse has to uh, provide the care, each and every care to those patients. Okay, so these are the cases that are to be assigned to the nurses. So that is case method. Okay, next the patient has a different nurse in each shift and no guarantee of having the same nurses the next day. Nurses' responsibility includes complete care, including treatments. What type of the activities have to be done by the nurses? These are the activities including the treatments, medications, and administration and planning of the nursing care plan. Okay, so different types of problem like the sleeping disturbances or the we can say that eating disorders or the eating problems. Okay, so these are the problems that have to be managed or have to be dealt by the nurses. Next is this is the way most nursing students were taught take one patient and care for all of their needs. This model is used in the critical care areas, labor and delivery, or any area where one nurse cares for the one patient totally. In the starting, I have told you about that the one single patient would be assigned to single nurse, mostly in the ICUs. This type of method, this case method, is used that you are assigned with this single patient and you have to do each and every care from bed bath to back care or any type of care, treatment, medication, or catheterization or catheter care or any type of. Okay, so this is the method by which the student nurses are being taught nowadays. Okay, next are the some of the merits of this method. A nurse can attend to all the needs of the client due to the adequate time and proximity of the interaction. So the total number of patients to whom the nurse has to serve is less in number, so that will increase the effectivity of the patient care. Second one, good client nurse interaction and depth can be developed because only one or two maximum the total number of patients are assigned to the nurse. So their IPR can be built in an effective manner. Next, client may feel more secure. RNs were self-employed and workload can be divided by the staff. So it is an easy method. So you have to just deal with a single patient or one or two patients. Okay. So there is the less burden on the nurse and there is an increase in the effectivity of the work done. Next, nurse's accountability for their action is built in. It is used in critical care settings where one nurse provides total care to a small group of critical ill patients, like in the ICU. Okay. Next are some of the demerits of this method. What are the demerits? Second, it includes the cost effectiveness. Okay, that is the issue because the critically ill patient have to provide the different types of services, and we need a highly trained staff for these. Next, second, the greater disadvantage to care is nursing occurs when the nurse is inadequately trained or prepared to provide total care of the patient. So that is what I actually said is that for this type of method, we need only the trained ones. Okay. Third is nurse may feel overworked if most of her assigned patients are sick. Okay. So if the patient is assigned to the nurse are in critical situation, in very critical situation, so that can increase the burden. Next, last is he may tend to neglect the needs of the patient when the other patient problem or need demands more time. Okay, so you have to provide care to a single patient or one or two patients, and you have to do each and every care. Okay, so there is a requirement of a lot of time for providing such care to the patients. But in condition, in any situation, if there is the more time is required to provide the care to the patient, and there are other patients also who are in the need of the care. So there can be the problem. There can be a problem that have to be dealt by the nurse. Okay, so that is also a demand. So that was about the case methods. Second one is the functional nursing. What are the features of this method? This system encouraged emerged in 1930s in USA during World War II. when there was a severe shortage of nurses in the US, number of licensed practice nurses and nurse aides were employed to compensate for less number of registered nurses who demanded increased salary. It is task focused, not patient focused. So that is exactly the line or the meaning that is mean what we mean by the functional nursing. That means uh, there is that is not patient focused, it is functional focused, focused on the function. That means, for example, it is a team. We can say that the function, that means we are assigning the patient, but we are assigning the different functions of the that one nurse has to do this type of care to the specific patient, and other nurse will come and that will perform the different these type of function on the same patient. Okay, so in this model, the tasks are divided with one nurse assuming responsibility for specific tasks. For example, one nurse does the hygiene and dressing changes, whereas another nurse assumes responsibility for the medication administration. For example, a staff is assigned with the patient that this is the patient and you have to do a complete care. So in the case method, there was a single nurse for the one or two patients, and he or she has to do the all the care or the procedure on that patient. But in the functional nursing, the patients are assigned to the nurses, but also they are assigned with a some specific function that you have to do this, but you have to just do the same patient. Okay, for example, like it is written hereby that hygiene and dressing changes will be performed by the one person, and whereas another nurse would assume the medical administration, medication administration, or any other type of function. Okay, typically a lead nurse responsible for specific shift assigns available nursing staff members according to their qualification. So it is based on the qualification, what type of skill a nurse, specific nurse is having. So based on that skill, they are assigned with the functional nursing. Okay, this is the a picture showing the care done in a functional nursing. That is the charge nurse. That is the head of the. You can say that the nurses. Charge nurse will assign the patient. Uh, for example, you can see RN medication nurse that will only do the medication work. Second RN treatment nurse, and in LP and vital sign nurse that will be relating with the whose function will be relating with the vital signs record. And last is UAP, that is hygiene nurse, or that has to perform the bed care, bath, uh, bag care, bed bath, or catheter care, or any other type of care, the maintenance of the hygiene of the patient. Okay, so that is I also because that it is a teamwork. Okay, on a single patient. Next are merits of this method. What are the various merits? Each person become very efficient at specific tasks, and great amount of work can be done in a short time because uh, single or one or two patients are there, but now not a single person is responsible for all the care. So different persons are there for the different type of functions of the providers of the care. So it will increase the effectivity, and it is easy to organize the work of unit and staff. So it is uh, easy job that is to be done in an easy manner because there is a less burden. Okay. Next, the best utilization can be made of the person's aptitude, experience, and desires. Okay, so the best utilization, what is it is about the person's aptitude experiences because different nurses are skilled in different types of functions, so they can use their skills. Next, the organization benefits financially from its strategy because patient care can be delivered to a large number of patients by mixing staff with a large number of licensed assisted personnel. For example, if we are having the fresh nurses, so we can mix them with the experienced nurses, and they can teach them how to provide the care. Okay. Next, nurses become highly competent with tasks that are repeatedly assigned to them. So have to do only the limited functions, so they can be skilled in that. So that's the man. Next is less equipment is needed, and what is available is usually better cared for when used not by not used only by a few percent. Okay, so less equipments are required for the providers of care. Okay, that is also last one are the demerits. What are the demerits? Client care may become impersonal, compartmentalization is there and fragmented. Okay, so now there is not a single person that is providing care in this method. So there will be the less chances of the IPF. That will not be like as in the case method. Okay. Second is continuity care may not be possible. Okay. And third one is the staff may become bored and have little motivation to develop self and others because they have to only to do the less activities of the specific function, the limited function. Next, the staff members are accountable for the task. Okay, so all the staff members are responsible. Client may feel insecure because some functions are done by the uh, one nurse and some are by the another nurse. So the patient may feel insecure or he or she might be fearing from that why this is happening, that there is a change of the nurses, okay, in day-to-day activities. Next, only parts of the nursing care plan are known to the personnel, and patient gets confused as so many nurses attend to them. So this is what I was talking about, that there are a number of nurses. So patient may feel that he or she might be critically ill. This is why there are a number of nurses that are attending the specific patient. Okay, head nurse, medicine nurse, dressing nurse, temperature nurse, etc. Okay, so as psychologically, we can say that there is a development of fear. Why a number of nurses are dealing with it. Okay, so that is about the functional nursing, its merits and demerits. Okay, so that was about the today's topic, patient classification system, and how we can categorize the patients. And there, I have explained you about the two methods. It was about the functional nursing, and second one was about the case method. Okay, so next methods will be explained in the next video, in the next week. So I will continue with this topic, and with the name of the title will be Patient Classification System Part 2. Okay, so be in touch with me. Thank you, everyone. We'll meet in the next video.